I'm Chiu. I'm from Faculty of Pharmaceutical Sciences. Today, I would like to talk about the faculty community and social engagement project that my students has been doing all this while. So our students actually get involved actively in the public health campaign annually. So public health campaign is actually a very prestigious event offered free to the community. In order to make the services free, our students will have to raise some funds in order to support this public health campaign. And other than that, students will have to find some sponsorship in order to support this activity. Example, like looking for suppliers to sponsor the Google strip for those consumables like gloves, cotton, alcohol for this public health campaign. So to raise the fund, our students will have some activities which they will have it annually. Example like the active burning calorie, which will held every year in March to raise the fund. And they will also have some movie nights and debate competition in order to raise some fund from this kind of activities to support the public health campaign. So a little bit of history on this public health campaign. Public health campaign started since 2002 by our UCSI University Pharmacy Student Association. This campaign is held annually at various venues in our effort to promote health awareness to the society regarding disease prevention. So every year we will have a theme of what kind of disease that we would like to concentrate into it. Example, like in the past, we have concentrated in the kidney disease, cancer, heart disease, and etc. So the objectives of this public health campaign is to promote and educate the public on disease prevention through screening and early detection. So during the campaign, we will provide some very basic screening activities for the public so that they will get to know that whether are they at any risk in getting these diseases. So we can advise them to go for more thorough checkup if it is necessary. And the second objective is to educate the public on the importance of medical checkup, because some of those public, especially the older public, they may not perform the annual checkup every year. So through this health campaign, we can actually educate the public what is the importance of having the medical checkup annually, and so that they will be able to detect any disease at the early stage. And the third objective is to improve the community health and social activities and to bring about positive changes in their lifestyle. Our student who has been educated and trained in the health information will be able to tell the public that what kind of health and social activities they need to have in order to maintain a healthy lifestyle, and also their food intake. Okay, what kind of food it is good for them, what kind of food which is actually bad for them, so they get the information correctly, and hopefully they were able to assess themselves when they got back home. These are the among posters which we have it in 2003, and the one is in last year, which is 2017. So in 2003, we actually have it in Perak, in the Maidin Mall, Meru Raya, Ipoh, and we have actually performed several health screening. And as you can see from the poster, we actually get sponsors by the Easy DNA and NKF Foundation. And in 2017, which we had it last year, instead of doing it in mall, we have it in those residential flat. So we had it in the Siri Cendekia flat in Cheras. So this activity is supported by SAA and also some suppliers for our activities. So if you can see that each of it will have a different theme. So in 2013, our focus is more on kidney. In 2017, our focus is more on heart. So in this campaign, there are services available, and most important, they are free to the public. So the free screening services available including like blood pressure tests, body fat tests, blood glucose tests, which we will ask our student to perform this test, and from the result, our student will explain the result to the public. And we will also organize a corner where we can actually have our education showcase. Example, like our pharmacy student will do the drug compounding demonstration to the public so that they know how drug is being formed, like how do they form the tablet, how do they form the cough mixture, how do they form the capsule, how do they form the eye drop, and etc. etc. And we will also have pharmacy staff who actually help in the know your medicine, where our pharmacists will actually have a counter, so whoever public have doubts in their medication, they can actually approach our healthcare profession and get more information about it. And also we will have a corner for the drug compliance, so public will actually benefit a lot from this education showcase, and also the free screening test available. So these are among the examples of a picture that we have from the public health campaign in the past. Like the one in the on my left is the free blood glucose test. So we actually perform the blood glucose test using the blood glucose meter, where our student will get some blood sample from the public and perform the instant blood glucose test, so in order to tell the public whether are they at risk of getting diabetes. Of course, one of the requirements in order to perform this free blood glucose test is patient must be at least fasting for 4 hours. The one on my right is the free blood pressure check. So in this free blood pressure check, we will allow the public to know whether are they having or prone to high blood pressure, so they can actually take a little bit more precaution after the event. And the next is the one on my left is the body fat test, where our student will take the chest, waist, and hip circumference, and in order to get what is the waist to hip ratio, so that student will be able to advise whether the person is actually at the higher risk of getting what kind of diseases, because we know that if you have a out of range waist to hip ratio, you are very prone to certain diseases. And the one on my right is the drug compounding demonstration. Mainly this drug compounding demonstration is to allow the younger generation to know how drugs has been formed. So this will usually performed by our student as well. Our student will show the younger generation those medicine that they got it at home, how it is being formed. Okay, how do they form a tablet, how do they put the active ingredient into it and make into the medicine that usually they can get it from the pharmacy. So this is more on the education for the public, and this can also allow the public to have some interest in the pharmacy profession. Other than that, we also have the exhibition related to health issue, just like what I've mentioned just now. Every year we will have a theme. So the exhibition will be related to the theme, where our student can actually explain to our public what is the information or knowledge which is related to the health issue. So usually our student will present their posters, information, what are those latest information available, what are those national standards which is set by the Ministry of Health of Malaysia, so that public will actually get the correct information from us. So we will also have some media coverage after the event, and example like the newspaper cutting, okay, from Star newspaper. So these are among the two media coverage that we had in the past. And lastly, my suggestion for improvement is to work together with the public or private sector for more complete health check. Example, I will suggest to work together with the blood bank for the blood donation campaign, because usually what I notice in blood donation campaign, we will be able to draw more crowds to the event. And other than that, probably we can actually work with some diagnostic lab, example like Path Lab, BP Healthcare, in order to perform a more complete or more thorough body checkup, where patients will get to provide their blood samples and urine samples for the lab to analyze at a very low cost compared to the price which they offer in the diagnostic lab. So in this case, patient will get to benefit a lot more from this kind of campaign. And lastly is to collaborate with the NGO organization to reach more public, example to collaborate with MPS, where this NGO organization will help us to reach more targeted public, which is related to certain theme or certain disease or of that year. Example, let's say if we are working with the on the kidney disease, then probably the kidney foundation will be able to introduce to their kidney patient that we have this kind of campaign at certain date at certain location. So I think that this can help us to gain more public awareness to the event. So that's all for my presentation. Thank you.